So what I'll do, you can bend forward to touch the toes. This is for the assessment when you come in, straighten up. Side slide left, keep the feet flat. Slide right. Twist around, keeping the pelvis level. And the other side. And then onto your toes. Onto your heels, keep the toes off. Okay, just crouch down. Does that feel like in the lower back?
No, it feels okay.
Okay, back up. Have a seat up on the middle here. Let's get you to push against me. And pull back. Push against me. And pull back. Push the ankle up to the ceiling. The ankle up. Toe up. Toe up. Squeeze together. And apart. Push up. And up. The arms up. Bend. Pull towards. And push away. Towards. Push away. Squeeze the finger and thumb together. Hold there. There. Just relax down. And relax the arm. Again. Relax. Right. Again. Good. Good. That's great. Alright, just check your sensation. Cotton bud and toothpick. Close the eyes until I say open. Tell me what you feel. Do some on the upper body and some on the lower.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft. Sharp. Sharp. Soft. Sharp. Sharp.
That's good, you can open your eyes, well done. That's good, let's get you to lie on your back, please. Just relax. Okay. Good. Alright, let's take the leg back. So we're looking for anything shooting down into the leg for sciatica. Good, there's nothing, no numbness, tingling or weakness going down into the foot, so we should get past 70 degrees, sciatic nerves fully stretched there. If someone was getting problems between 30 and 70 degrees, there would be a problem most likely coming from the disc. We'll do some further testing for that. So, let's say for example if there was numbness, tingling or weakness going down to leg here, I would lower it down till there's a point where there's no pain felt. Then I'd bend the knee and I'd apply pressure behind the knee and see if it would reproduce the problem. It could then indicate there's definitely something happening, a space occupying lesion or something pushing on the nerve as it exits the neural canal. So either from the bone or from a disc. There's further tests that we'll do. Just for the sake of some examples of what we do when we're testing, get you to raise both legs off the table and you try and hold it there by yourself for 30 seconds. Often that would create some problem. The patient would have to bend their knees to then relax. If they were getting some problems down into this leg in the distribution before 70 degrees, then I would check the opposite leg, and if that was then creating pain on the same side, again it would lead me to think that there's some further testing, perhaps some referral needed like an MRI or something like that, but we'd have to put it all together in a further exam. Let's get you to come back up, have a seat on the middle of the table. There's another test perhaps that we'd do, it's called a slump test. So I would get you to slump forwards and keep the head in neutral, just up. And then I'd get you to straighten this leg, point the toe back. That would often create some zinging pain down into the foot. There's another test, nerve tension test. It could be that the actual disc creating problems. Again, we'll get you to straighten the other leg as well. Point the toe back, slumping forward. Obviously that would be quite painful. Both legs together. Point the toes back and then forward further, and that would actually cause probably the knee to bend and buckle as well. So get you to lie back on your back and show you another one. It's a Koenig-Brzezinski test. So what I do is get you to tuck the chin in, raise one leg, If you're having to buckle that leg because of pain going down, again, it's another sign that there's a problem with the disc. And same with the opposite side, again, that would cause a buckling of the. Now, just get you to turn on to your side facing this way. It's a test we'll do for a tight iliotibial band. It's the Ober's test. So the patient will come over to the side of the table, just move back a little bit further, straighten the leg, and then if they can't lower it down over the table, it indicate that there's something happening in the iliotibial band and some tightness there. Let's get you to stand up if you can, doing quite well. It's just another example, hypothetical example of some tests that we'll do so you understand what you might have when you come in. It's the last one I show you. It's what we call a Trendenburg test. So if you get to face that way, what you do is you'd raise your knee on this side and you'd look for the pelvis to stay level. If the pelvis drops this way, it would indicate that there's a glute weakness here in the minimus, and it would cause the hip to drop that way. So, you know, there's some definite some tests here that you've taken part in that would help us as we're going through as a patient chiropractor. But really the idea of this video is to show you some simple tests that we do. We'll put them all together, and depending on each individual when they come in, we'll put that together with the history, with the reflexes, the muscle strength, the sensations, so the neurological exam, and then from there we do some other tests as well. So this is just an example of what might happen when you come in no particular order, to give you a better understanding of what the sort of things would happen when you come in through an assessment. Thanks very much.